The most common thing patients request when they come in for first-time augmentation is they say, I don't want those breasts that are way out to the sides. Well, that is a common reason also that patients come back in to have revision of their breast surgery. Now, some of those patients can't be moved closer together, and some of them can. There are a lot of patients who just by virtue of their own anatomy have a wide breastbone and their breasts just sit wide on their chest. And their chest oftentimes in these women bows out a little bit to the side. They're just not meant to have contact cleavage. And I think a mistake that some of these patients and their surgeons make some of the time is that they may go bigger in the hope that it'll get them cleavage. But what happens is, as those breasts go bigger and they still have a wide gap, it just looks all the more odd because we know that nature doesn't make people with big breasts with wide gaps in between. So if I see a person who has a wide gap and it's just the way they're built and they have big implants, I'll actually sometimes suggest putting in a smaller implant and just accepting that. I think that often can look better, and that's just the way they're meant to be. Other times, however, the implants can migrate out to the sides. You know, I remind people that when they lay back, your chest is kind of like the roof of a house, where your breastbone's there, and at some point you have to roll backwards to get to your back. And so when you lay in bed, there's a natural tendency of the implants to fall out to the side. Bigger and heavier implants will fall more. People that have more of an angle will have them fall more. And if at the time of the first operation the surgeon dissected a wideish pocket, it also can make it go out to the sides more. So if the implant actually is displaced to the side, then we'll sew up the sides and help bring the implants back together. I have to say though, of all of the malpositions, that's the one that seems to want to recur the most often. We can fix it and we can help it and we can improve it. But it is one of the situations where sometimes if you look carefully over time, there is some tendency to creep out. But if it's well done, if you have it done with an implant of an appropriate size for you, then generally a very significant and long-lasting improvement can be made.